Speaker. It's a pleasure to follow on for the member for Caithness, Sutherland and Easter Ross. And I would like to say today that I think the NHS long-term plan will be critical in tackling health inequalities, and I welcome the announcement that the plan will deliver by addressing these inequalities through working locally, specifically targeting areas of unmet need. I am mindful that I live in and represent a constituency which does have a life expectancy for men and women above the national average. However, there is an inequality within Guildford between those who live to the north of the A3 in the Westborough and Stoke wards and those who live south of the A3, who can roughly expect to live 5 years longer than their northern neighbours. I pay tribute to the excellent work that has been undertaken already by the Guildford Health and Wellbeing Board, who produced a report in 2017 running through to 2022. This report was produced in partnership with the area clinical commissioning groups, the local authorities and voluntary organisations who are key to the important on-the-ground implementation of help and support within our community. And I believe that by empowering our community volunteers, this will be crucial in narrowing health inequalities. The first priority outlined in that report was to support people to take responsibility for their own health and well-being as much as possible, and this principle must always be the starting point in tackling inequality of health outcomes, and committing to a prevention-first approach is vital. Where individuals are able to, with support, look at habits around smoking, alcohol consumption, food choices and exercise taken, there will be a huge impact on reducing not only physical health problems but mental health issues as well. Madam Deputy Speaker, our local authorities do an excellent job of promoting their parks and recreation facilities, holiday activities for children, and we expend much energy on protecting our green spaces. It's vital that we use them. Voluntary groups like Smart Cranley are working hard in the social prescribing sphere, helping those who are socially isolated, which we know can have a detrimental effect on life expectancy, as my honourable friend, the member for Ashfield, so eloquently put previously. Councillors have just opened a community fridge in Park Barn in my constituency, which stocks fresh vegetables, key in being able to have a healthy diet. However, there will always be those who need support and medical intervention, and the government's commitment to deliver £33.9 billion worth of investment into the NHS will, I believe, make reducing health inequalities possible. I welcome this investment and trust that with the excellent work already undertaken in the Guildford constituency, identifying areas of need, that we might qualify for targeted support to improve the quality and the length of life for my constituents who need it the most, and I am pleased to support the government's amendment this evening.